Has expired, and I call the member for Higgins.
Thank you, Mr Speaker. I'm delighted to stand here after my maiden speech to speak on behalf of the fact that, thank you, first speech, maiden speech, and that we as a government are delivering on healthcare. We're delivering in so many ways, and I'm very proud of the fact that Minister Greg Hunt has made some fantastic announcements in the lead-up to the most recent election. We've invested in record hospital investment, record bulk billing and a Medicare guarantee. With regards to record hospital investment, the federal funding for public hospital services under the Liberal and Nationals government has increased from $13 billion in 2012-2013 to $21 billion in 2018 to 2019 to $26 billion in 22 to 23. That is the fact. The facts speak for themselves. This means more hospital services, more doctors and more nurses. Now, we on this side of the House understand that investment in health is so important, but we also understand that Australia has one of the best healthcare systems in the world. And it is true that we can always do better. In fact, it's important that we do better. And by investing in record health investment, record bulk billing, with an increase of 4% in bulk billing in the period of time that we've been in government, with over 133 million free GP services delivered last year, 27 million more than in Labor's last year in government, I can proudly say that we've increased our GP bulk billing rate from 80 up to 86%, from 82% in Labor's last year in government. So these are important facts that speak for themselves. We've also delivered the long-term future of Medicare. Mr Speaker, this is incredibly important for those who need a Medicare Guarantee Act to ensure that we have we have sufficient funding to ensure that we have diagnostic services, including ultrasound and X-rays, to reduce the cost to patients. If you can't manage the economy, Mr Speaker, you can't manage health. But I'd like to also say that there are two areas that I'm particularly delighted with the increased attention that this federal government has given in this term of government. And the first of those is mental health, and the second is something that's very dear to my heart, and is medical research. We all know someone who has been deeply affected by mental health. Mental health is such an important area to invest in, and the government is boosting mental health funding by $736 million, with $460 million focused on addressing youth mental health and suicide prevention. Yesterday, in my first speech, I talked about how mental health had touched my family very deeply. And I know it has touched so many lives in Australia and around the world. But the high rate of suicide, particularly among young people, is a national tragedy. We need to recognise the causes of suicide and that they are complex and they extend into social services and finances. And our Prime Minister has recognised this, and he has made suicide prevention a key personal priority by creating a suicide prevention coordinator in his department to coordinate suicide prevention initiatives across the whole of government. This is a very, very welcomed initiative. The $460 million that is committed to youth mental health and suicide prevention includes investment in health headspace networks, including, I'm delighted to say, one in Higgins, which will be very important since we have a very large population of young people, and also a very large population of the LGBTI community, who unfortunately are a vulnerable population when it comes to this particular area. I'm also delighted to say that $152 million will be used to reduce wait times at Headspace around the country, a $2 million investment in the Young Ambassadors for Mental Health project, and $110 million to continue the early psychosis youth services program at 14 Headspace centres. These are very important initiatives which are really seeking to address what is a particularly important problem for our young in our community. And our government is leading the world in addressing eating disorders, with a $115 million announcement in December for the first time for Centres for Severe Eating Disorders, and this really is an international first. Lastly, in my last few seconds, I'd like to say that medical research is such an important area to invest in, and I'm incredibly proud to be part of a government that has delivered the Medical Research Future Fund, which is a world first. Thank you.